Okay, we are live. Good evening, everyone. Today's session is going to be really helpful and it's led by Dr. Ananya Rangaswamy, high risk pregnancy specialist from Apollo Cradle and Children's Hospital. She is going to talk about National Safe Motherhood. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Hi, good evening. I'm Dr. Ananya Rangaswamy. I'm an Apollo consultant obstetrician and gynecologist at Apollo Hospitals in Rajajinagar. So today, this month being April, April is known for its Safe Motherhood Day. So we wanted to hold this session regarding safe motherhood on behalf for this month. Okay, so what is Safe Motherhood Day and why is this Safe Motherhood Day celebrated? I would like to start with that to start off with. So April 11th of every year is celebrated as Safe Motherhood Day. This initiative was started by the government of India in the year 2003, and from then we have been celebrating every year April 11th as the Safe Motherhood Day. Why do we choose this particular day as the Safe Motherhood Day? It is actually in remembrance and in giving gratitude and respect towards Srimati Kasturba Gandhi, who was the wife of Mahatma Gandhi ji. So she was very inclined towards women health and maternal mortality and maternal health. So in remembrance and as a gratitude and as a respect towards her, the government of India started celebrating this on her birth anniversary. So April 11th happens to be Srimati Kasturba's birth anniversary. So that day is celebrated as the Safe Motherhood Day. So, why did the Safe Motherhood Day start off? Safe Motherhood Day started because India is still on the higher range of maternal mortality. Till now, even today, the maternal mortality rate is at about 12%. And India stands at one of the countries which is having a very high mortality, maternal mortality rate. That means that the women who are dying because of pregnancy and its complications, the women who are suffering or having mortality or death because of poor hygiene, poor healthcare facilities, poor birthing facilities, which is not made available to them. So because of those things, the mortality that is happening in women is increasing to as high as 12% in India. So to cut down this and to give better mortality, better maternal care to the pregnant women, the government of India has started this initiative. So this session today, I would like to hold just in general to talk about maternal well-being and what are all the facilities that are available both by the government of India and what are the general precautions that a mother has to take care in order to avoid any complications in pregnancy. Okay, so pregnancy, in the olden days, everybody used to think that once the pregnancy is confirmed, there is no need to visit the doctor on a monthly basis, or we can visit the doctor only once 3 months is complete, once 5 months is complete. Then is when her tummy probably starts to show. That is when the pregnancy becomes important. Let us show or let us start going to the doctor only after that. No need of going to the doctor as soon as you are confirmed that you are pregnant. No, that is a very wrong notion which the government of India and we doctors in general are trying to bring an awareness about. So when your period is missed, so your period is expected on a particular day, so from that last menstrual period, if you miss your next cycle, when you're having regular cycles every month and you happen to miss your cycle, that day itself you can confirm your pregnancy by doing a simple urine pregnancy test at home itself. So this pregnancy test becomes positive as early as 30 days of your period itself. So the day of your missed period, you can do a urine pregnancy test, and if it comes positive, you can immediately visit the doctor, a gynecologist, or a general physician in the beginning, who will guide you as to what has to be done during this whole course of your pregnancy. Initially, we advise that folic acid supplements, which is started during the first 3 months of pregnancy, if a lady visits us before the pregnancy itself, or if a lady who visits any government primary health center, any reproductive age group mother is always started on a folic acid supplement before pregnancy itself. But if she misses going to the doctor before pregnancy, then at least as soon as her pregnancy is confirmed, she has to visit the doctor or visit a government health setup where the folic acid supplements are given to her. In every government hospital, this supplements or any of these supplements are given free of cost to the mother, and the basic facilities like the consultations or the basic blood investigations, the basic scans, everything is supposedly provided free of cost to any mother. But in a private setup, the mother has to visit the consultant and she has to go through all the investigations and the scans which is advised to her from time to time. So the first thing that she has to do is, when her urine pregnancy test comes positive, visit the doctor, start the folic acid supplements. And the confirmation, the urine pregnancy test confirms the pregnancy to 90%, that there is a pregnancy that has started to grow in the body. So to confirm that this pregnancy is healthy, the heartbeat has started, the pregnancy is going on well and it has started well, we need to do an early pregnancy scan, which is known as the viability scan or the first trimester scan, which is done usually between 6 to 8 weeks of pregnancy. So that is the time when the heartbeat starts to be seen on an ultrasonography. So she has to do this scan. So this confirms that the pregnancy is good and it has started inside the uterus. There are some complications where the pregnancy might happen sometimes outside of the uterus. So that is known as an ectopic pregnancy. So that should be ruled out in the first trimester. And there can be some other complications like first trimester bleeding can be there, first trimester missed abortions can be there, first trimester abnormal pregnancies like molar pregnancies can be there. So all these are abnormalities of the pregnancy which have to be picked up within the first 3 months of pregnancy. So the woman should not be under the notion that let us go to the doctor after 3 months of pregnancy. So first 3 months initial investigations and the first confirmation scan is a compulsory and it should be done. So this awareness is more so towards rural women and women who are living in areas where the facilities to reach a doctor or to reach a hospital is difficult. So there is a primary health center and there are health workers who go from door to door finding out that there is a woman of the reproductive age group and who tell them regarding the pregnancy, what supplements need to be taken, how the pregnancy should be cared for, to visit the doctor, to get the blood test done. All this is provided to them at the doorstep itself. So this initiative prevents any early first trimester abortions, complications, any abnormalities in the baby, all these by giving them the awareness and giving them the education about this. So the first 3 months have to be taken care of in this way. So next what is done, every primary health center or every health worker will give a tetanus toxoid injection, that is a TT vaccination which is given. Initially in the government setup, usually it is covered within the first 3 to 5 months itself, where the government offers free vaccination, that is 2 doses of tetanus toxoid that is given. But if you visit any private health center or if you go according to the guidelines of CHC or the child health care and maternal care, 2 doses of tetanus toxoid is given and 1 dose of flu vaccine is also given at the time of 5th month. Okay, so but the 2 doses of tetanus toxoid should not be missed at all, and the government health setups provide this free of cost to all the pregnant women. This again prevents any infection to the mother, which can be passed on through her placenta to the baby. So tetanus infection is a very deadly infection which can cause very severe infections and mortality and morbidity to the unborn baby and to the newborn fetus also. So this tetanus toxoid is administered to all the pregnant women free of cost. 2 doses have to be taken. So this is one more thing that has to be taken care of. Next, moving on, what else is important and what else is compulsorily provided by the government of India? That is the 5th month anomaly scan. So at 5th month, all the development and all the organ development and the limbs and everything is completely developed in the baby. So anywhere between 18 weeks to 22 weeks, that is the time phrase, or that is that period where we can clearly see all the organs of the baby, where we need to do an assessment of the anomalies of the baby. So I'm sorry to interrupt, but there is a question that has come up. How does access to quality prenatal care impact maternal and child health outcomes? So that is exactly what I'm trying to say. The quality will be better when these supplements and when these investigations or the basic abnormality investigations and everything is assessed well. If supposed a mother is diagnosed with some abnormality of the child, she does not have to carry such a fetus till the ninth month of pregnancy. If suppose she is diagnosed with an anomalous baby which will not survive after delivery, then we can always advise her regarding the outcome of the pregnancy. If she is diagnosed with placental abnormalities like placenta previa or a low lying placenta, which can cause severe bleeding in a mother during delivery, we should advise her to go to a tertiary health care for delivery. We should advise her if she can undergo a normal delivery or not, or whether she has to undergo an elective cesarean section. If at the time of delivery she is diagnosed with abnormal presentations like a transverse lie, a breech presentation, multiple gestations, or any such other pregnancy outcomes which require special care and tertiary care, the mother can always be advised to go to a higher center where the facilities of NICU is available, the blood bank is available, where the NICU is available for the baby, where the ICU is available for the mother. If there is excessive blood loss, then she can go through where the blood bank is available. So all such things will not be available in a remote area. So if she happens to deliver with such a complication in a remote area, then the mortality increases. Then the baby is not tended to properly. So such high risk pregnancy, the main aim of this safe motherhood is to catch or pool the high risk pregnancies and to allow them to deliver at a very safe and facility where all the facilities are available. So that is the main reason why the safe motherhood day is practiced. If the pregnancy is smooth, where she does not have any complications, she is taking all her prenatal medications, all her investigations are normal, then she can always opt to deliver at a basic government hospital where the doctors are available to deliver her safely. Okay, and that can be taken care of. But if it is a high risk pregnancy, she should make sure that she delivers at a more better and a facility oriented center. Okay, so the second month is where we diagnose that the pregnancy has come to a good level, the anomalies are ruled out, the baby has developed well without any abnormalities. So that is again done. The vaccination should be complete, and in the second month, after the folic acid supplements are completed, from the third month onwards, the iron and calcium supplements are started. So as we know, India is a country where the nutrition is deprived for some women, the backward women and the women who are living in the rural areas, they don't have very good nutrition. So to see to it that the mother who is growing a child within herself has good nutrition available to herself, the government of India provides free supplements of iron, calcium, protein supplements, basic grains, some dals, and iron rich foods. All this is provided at their doorstep by the health workers so that their nutrition improves, so that their hemoglobin level improves during pregnancy, and she does not become anemic and she does not have any complications during delivery. So all women should start iron and calcium supplements from the 13th to 14th week of pregnancy, which is continued throughout their pregnancy. Protein supplements, which can be taken in the form of milk powders, is given to them, which they can mix with milk and they can have on an everyday basis. So all these are nutritional supplements which will help in the mother to be healthy and the baby to also get adequate nutrition, good blood supply, stronger bones with calcium. So all this is given to the mother and to help in the good development of the baby. So this is continued, and any vaccination which is missed in the first trimester of pregnancy, that is folic acid, that is tetanus toxoid or the flu vaccine, these vaccines can be taken during the second trimester. And one more important investigation that we do is serology. Serology is nothing but HIV, HBsAg, VDRL, and HCV or hepatitis C virus testing. So these are also done free of cost in the government setups, and this is a compulsorily done investigation in all pregnant women. If by chance a mother who has contacted this infection unknowingly or through a needle prick injury or through unhealthy practices or from a blood transfusion or has a sexually transmitted infection, all these have to be picked up during pregnancy, so that if by chance she turns out to be serology positive, that is HIV positive or HBsAg positive, these infections can be prevented from being transmitted to the baby by giving the right medication to the mother. And again, I am telling you that these are provided free of cost by the government. So diagnosing if she has any such infections before pregnancy itself or during pregnancy is very important, so that the baby is prevented from getting these infections. So these testing is also done during the second trimester or during the first 5 months of pregnancy. Then coming to the last 3 months or the third trimester of pregnancy, that is when the mother starts to prepare herself for childbirth. So she has to decide where she is going to deliver her baby, whether she has any complications in her pregnancy, whether she can deliver at a regular primary health center with a delivery room which is available, with a 24 hours service of an ambulance that is available, who has a midwife or a delivery assistant who is available, and a doctor who is available on call, who is a gynecologist, and they should be available on call, so that if the mother goes into labor in the night or in the odd hours or on a holiday or any such days, the doctors, the midwives, everybody should be able to attend to her immediately. Only then she can deliver in such places. Okay, so what are the most effective strategies for promoting family planning and contraception to support safe motherhood? I will be coming to that once the patient delivers at that stage. Okay, so she decides where she is going to deliver her child, whether it is a safe place, whether all the facilities are available. So this should be decided at the third trimester. Any missing vaccinations should be completed, her medications and her supplements should be continued. And towards the end of her pregnancy, we do a final term scan which tells us about the expected birth weight of the child, how is the liquor quantity or the water content around the baby, whether the baby is in cephalic position, that is head down position, to deliver the baby vaginally. So all these are the indications that she can have a safe vaginal delivery. So all those have to be finally finalized during her third trimester of pregnancy. And like I told, if there are any complications in pregnancy, like a twin pregnancy or a pregnancy with diabetes or hypertension, or if the baby has got any abnormalities like IUGR, if there are any placental abnormalities like placenta previa or any such abnormalities, then the doctor at the referral center or the primary health center will refer such pregnancies to a higher center. So she delivers naturally or via an assisted delivery, or if there are any complications, she delivers via a cesarean section. All this is decided near her term after 38 completed weeks. And if you feel that there is a chance that this patient may deliver premature, or the baby might be delivered premature if she goes into labor before 32 weeks or between 32 weeks to 37 completed weeks, that is when we say that the baby is premature. So at such times the baby will require NICU treatment, it will require a neonatologist who needs to take care of the newborn, because the newborn will be of a very low birth weight. So to take care of such newborn babies, you need an expert team of nurses, of doctors, and the instruments and the facility which has to be available. So if you feel anywhere that she is going to deliver prenatally or prematurely, or if she goes into labor prematurely, always the facilities should be available so that they are referred to a higher care center. So that is the whole purpose of maintaining the safe motherhood, so that the mother gives birth to a good child which can be tended to easily. And if she happens to deliver prematurely, the baby has to be taken care of, and there is no mortality of the baby or after childbirth of the baby also. Okay, so these are the things that have to be covered, have to be educated. So the main thing is education of the mother regarding her whole pregnancy journey, how she has to be careful, and what are all the things that she needs to take care. And from the doctors and the midwifery side, that they need to deliver the child in a safe and a conducive environment where the mother and the child is taken care of. Earlier practices where a dai or a midwife used to go to the homes and they used to deliver at home, the government of India is trying to totally ban these practices, because there are a lot of complications that we see because of such deliveries that are happening unhygienically and at home. So the infection rate is high, the bleeding chances of are very high, because of which the mother loses blood and she can have complications, because of which the maternal mortality increases. Okay, so these are the things that we advise any pregnant mother as soon as it's done, and the doctors provide all these facilities patients who are affordable, who are living in the 2 tier and 3 tier cities, for whom the facilities are available, good hospitals are available, they can always make use of that. People who are living in remote areas where the facilities are not very much easily available, they can make use of the government health setups and the primary health centers. The same treatment and the same advice is given across all the places, but the quality and the type of treatment that is given and the equipment which is there, that will vary from, obviously, from the place to place. Okay, so these are the things. Once the mother delivers safely, then another further advice which is given about taking care of the baby, because as soon as she delivers, it is not the end of the story. The baby is still newborn, it needs to be taken care of. What are the things, how to breastfeed the child, for how many days, for how long the mother should breastfeed, how often should the mother breastfeed, how she should take care of herself in the postpartum period after delivery. All this have to be explained to her. And regarding the contraception, like the question was asked to me, contraception is always compulsory and it has to be advised after the childbirth. Before the patient and the baby is discharged and sent home, we always advise them for contraception, whether she has delivered normally through a vaginal delivery or she has delivered through a cesarean section. We always tell the mothers to keep a contraceptive advice clear in them, and to keep a gap of at least 2 to 3 years before they plan to have their next child, so that in these 2 to 3 years she can enjoy her parenthood and she can tend to her newborn child very well. She can improve her health and she can go through this whole postpartum period very safely, and then she can get back to her normalcy. So she gains back all the weight that she has gained, or the nutrition that she has lost, so she can recoup her energy levels. And then her child is also grown, the baby has also grown to a good age where other people can help in bringing up the child. So that is the ideal gap between two children. So between 2 to 3 years she can plan for her next pregnancy. So before discharge itself, now there is something known as PPIUCD, which is postpartum intrauterine contraceptive devices, which is again given free of cost to everybody. So as soon as they deliver, there is a copper T which can be inserted to the mother, which can be kept inside the uterus for up to 5 years. So immediately after delivery itself, if they feel that they will not be able to come back, or they might forget about contraception, or they might accidentally conceive and become pregnant, so immediately after delivery, even if they've had a normal delivery or a cesarean section, a PPIUCD or a contraceptive device can be put inside the uterus and can be left, and she can safely be aware that contraception is assured for the next 2 to 3 years at least. Okay, so this is in brief about how we need to take care of the mother during her pregnancy. It should start before her pregnancy, when she starts planning for a pregnancy itself. It should continue throughout her pregnancy. Ideally, a gynecologist has to take care of the pregnant mother. If the facilities are unavailable, then a trained doctor or a primary healthcare worker at the rural area setup has to take care. Always visit the doctor on a monthly basis for your checkups. See to it that your vaccination is complete. See to it that your monthly checkups, monthly investigations, and your scans, which are advised time to time, are done completely and at the right time. And you have to plan beforehand itself. When you go into labor, that is not the time when you decide where you need to go or which hospital shall we go for delivery. Before itself, decide the doctor who is going to deliver your child, decide the place where you are going to deliver your child, have a good rapport with the hospital, with the doctor, so that you are comfortable, you know what to expect, how you are going to deliver, you are very comfortable with the doctor and the setup. That is when you will be more confident about delivering safely, and you will be healthy and you will deliver happily also. Okay, so these are the basic things that I want to tell. I hope everybody has had a informative session. If there is any issues or anything, you can always get back to us and we're always there to help you. So a safe motherhood day, the tagline is always be informed about your pregnancy, the complications, and be aware and be informative about what to expect and how to deal with the complications, and have a safe delivery and birthing practice to avoid any maternal or postnatal baby morbidity and mortality. That is what this whole initiative is for. Okay, so happy parenting and happy motherhood to all the expecting mothers and going to be mothers. Okay, thank you, and hope that if there are any questions from anything, I can answer those also. Shalini. Okay, so we will wind up this session. Thank you very much for the session. I hope it has been useful to everybody. Thank you.